Hello everybody, I'm NONYE'S Aganya, and I want to thank you for joining me today for my informational video series where I highlight various human characteristics and attitudes and attributes and its implication towards the developing of a trusting environment in the healthcare setting. And today I'm going to discuss the characteristics of an opinionated patient and also highlight further the ways that the healthcare practitioner can engage strategically with a patient with such attributes to improve the chances of a more successful dialogue within the healthcare environment. The opinionated patient is usually overly confident, and I found that patients who are opinionated tend to have an unhealthy level of confidence of their medical knowledge and also an unhealthy level of confidence to interpret their signs and symptoms of the disease process. And some patients may also have family members who are either doctors, nurses, and then they seek advice of such family members before presenting to the healthcare environment. And then sometimes some of these patients become very fixated on the advice that they got from their family members, and then they attempt to sway the outcome of the consultation process with the healthcare practitioner with such advice. Another way that patients could acquire this attribute is when they do a lot of internet research. They consult a lot of medical websites before coming in to see the healthcare practitioner. And based on the information that they get from a lot of these websites, they attempt to sway the clinical consultation views. And there are so many things that I've realized over the course of 30 years of seeing patients. And I documented some of these things in a chapter of my book that I titled Dr. Mom or Dr. Dad. And by the way, I am a doctor mom because I have 4 children, and as a nurse practitioner I sometimes become opinionated when I take my children to see their pediatrician, and I have to sometimes catch myself as I attempt to impose some of these opinions that I have as a clinician during these consultation visits. So Dr. Mom or Dr. Dad is a parent who comes to the clinic and, because they feel they know their children very well, which they very well do, some parents will want to impose their opinions about the treatment plans that should be initiated for the child onto the healthcare practitioner. And there are ways to engage strategically with such parents to improve a trusting environment in the healthcare setting. And some of these strategic ways of interaction can be found in my book, Tips for Effective Communication, a vital tool for trust development in healthcare. Because in conclusion, to build a trusting environment while interacting with patients with opinionated characteristics, it's important to note that the healthcare practitioner must never ignore the patient's views or the parent of a pediatric patient's views, but to engage in a manner to gain control of the visit while incorporating the views of the patient or the parent. This method of engagement is very important with the opinionated patient because it makes the patient understand that you value their opinion, but ultimately a dialogue must take place and that you are the healthcare provider who will initiate a lot of the treatment plans, a lot of the assessment and diagnostic process that is needed to help the patient achieve a better state of health. And much more can be found in this book, Tips for Effective Communication, a vital tool for trust development. And it's available on this website, www.nonye'S.com. That's www.nonye'S.com. Thank you once again for joining me today, and God bless.